All right. I think I'll go ahead and get us started for the session today. Just wanted to say thank you so much for joining us this morning. We are starting off our series of State of the Science talks, and I'm going to be kicking us off today with a talk that focuses on extreme weather and mental health. Um, I will be going through some of my own research, and I'll also be talking about other research that's looking at the impact of extreme weather events on mental health outcomes across the US and also around the world. And I just wanted to mention for folks who have AI bots that have joined to take notes, it's our new policy that we won't be keeping AI participants. So please feel free to join the session, or we I think are likely going to be making the recordings available for participants afterwards. So just wanted to make that note for anyone who has an AI assistant that's joining the meeting. Also wanted to mention to everyone that we don't have a Q&A function available on this webinar, but I will try to leave some time towards the end of the session for questions. If you have questions, you can feel free to post them in the chat. I'll try to keep an eye on the chat as we're going through the session today, answer questions as they come up. But also, if you have a question and you would like to share your question in person or share your question yourself at the end of the session, please feel free to raise your hand. And as we wrap up the talk portion of the session, we can unmute you so that you can share your question with us. So thank you so much again for joining us today. So just a quick disclaimer, I wanted to mention I'm speaking today in my capacity as an individual faculty member, and the views that I'm sharing in this presentation do not represent the official opinions of the CAFE Research Coordinating Center or of the NIH. So a little bit of background. We've all probably seen in the news a lot of different examples. I've pulled a couple from articles in the New York Times of the mental health impacts of different types of extreme weather events that are associated with climate. So most recently, we've been really interested in extreme heat. Also, there have been a lot of discussions about intersectional exposures to different types of environmental risk factors that are having an influence on mental health outcomes. So, we've been looking at not only extreme heat, but also the availability of power grids for air conditioning and other types of resources that might be available for different vulnerable populations. And we've also been talking about healthcare systems and the resilience of different types of healthcare systems to different types of health outcomes associated with extreme weather. And so I think that there's just this growing recognition in both the scientific community and in the policy community of the importance of bringing mental health into the conversation around extreme weather and health outcomes. And I think that we have to understand that urbanization globally is a key variable in this equation of extreme weather events and urban infrastructure and mental health outcomes. Today, 55% of the global population lives in urban areas, and this is expected to increase to 68% by 2050. This is predictions from the UN economics program. Um, and we know that rapid urbanization in different communities has a lot of benefits for different populations. We know that there is access to a lot of economic growth in urban centers, a lot of different opportunities. But we also know that concentration of very large populations in these urban areas around the world leads to worsening income inequality, higher levels of poverty, and a lot of adverse health outcomes that can be attributable to different types of environmental exposures. And one of the things that I want to mention at the front of my talk today is that I'm going to be focusing on a lot of examples that come from the literature across the United States. But I do think it's important to point out that a lot of this concentration of urban populations and a lot of the growth that we're seeing in global urban populations is in areas in the global south. So areas in sub-Saharan Africa are experiencing rapid increases in urban centers, of course, the Indian subcontinent and East Asia. So the story of urbanization and the risks of environmental factors for urban populations is one that is important in the US, but it's also important to view from this global health context as well. So I'll start off by talking a little bit about the burden of poor mental health in the United States. So this is data from the BRFIS dataset, the Behavioral Risk Factor Surveillance System. It was updated in 2022. So what we can see is that there are or there have been historically relatively well available data that indicates that some of these different mental health endpoints are really going to be problems in different communities across the United States. So this is showing areas in dark purple are areas where levels of depression or estimates of population prevalence of depression are relatively high across the US. We can see that there is a lot of concentration, for example, in Appalachian regions of high rates of depression. It's really important to point out that the Places dataset and the interface is not available anymore. So hopefully we'll be able to continue having access to this kind of information so that we can also track the long-term trends in mental health outcomes across the US. This is data from SAMHSA, which is the substance abuse program across the US. And what we can see is that there are differences in the prevalence of mental illness among US adults. There are meaningful differences by gender, by age group, and also by race ethnicity. And what we can see is that overall prevalence of mental illness has been relatively quite high in different populations across the US. And one of the things that's really important to consider in this picture of mental illness among US adults is that a lot of these different outcomes that are associated with mental health require specific clinical interventions. And so it's really important to, again, track these trends across time so that we can understand better where we need access to different types of clinical care in order to try and reduce some of these mental health impacts from all of the different risk factors that people experience. And so, looking at treatment rates, what we can see is that roughly half of the adults who have any mental illness across the US in 2022 were receiving treatment for their mental illness. So this means that there is a gap in the either the availability of clinical care or in the treatment-seeking behaviors among people who experience mental illness. And this is really important too, to understand that we are missing opportunities to provide treatment for people who are experiencing mental illness across the US. This is a figure from a study that was published a few years ago in 2021 that talks about PTSD in US populations. And what we can see is that there is some indication of disparities in the prevalence of PTSD. And this one is very interesting for me, and I think for a lot of folks in the research community, because previously we had pretty strict definitions of what constitutes trauma. So it was related to violence and related to specific types of violence, and then the post-traumatic stress disorder that people experience as a result of that violent encounter. And recently, there's been a discussion in the research community and in the clinical community about whether we should be expanding our definition of what constitutes trauma. And so I think as we can continue to refine our definitions of trauma and refine our definitions of the different events, types of events and triggers that might constitute trauma, that might also change our understanding of the overall population level prevalence of PTSD, particularly among adults across the US. And this is also data showing trends over time in lifetime and current depression rates. And this is based on survey data that was collected by the Gallup program. The poll was conducted in, I think, the beginning of 2024. And then what they were looking at was collecting survey data from a representative sample of US adults, asking, has a doctor or nurse ever told you that you have depression? Do you currently have, or are you currently being treated for depression? And what we see is that their rates have been trending upwards. So we do see that there over time has been an overall increase both in the percentage of people who have been told that they have over the course of their lifetime depression, and also people who are currently being treated for depression is on the rise as well. And this is an interesting factor because we do see that the rates of clinical treatment are increasing, but they're not necessarily keeping pace with the number of people or the percentage of the population that indicates that they have been told at some point in their past that they have experienced depression. This figure is from a separate study that looks at trends in anxiety among adults in the United States, showing that particularly young adults are experiencing increases in the prevalence of anxiety. So it's not limited to some of these more severe mental health endpoints, this trend over time, such as depression or major depressive disorder. There are increases in some of the less clinically severe outcomes, such as anxiety disorders and stress disorders as well. And of course, substance use disorder also shows us a similar picture. This is data again from SAMHSA showing past month substance use among people age over 12. And this data is from the 2023 national report. So it's again a couple of years ago of data that we have, and hopefully we'll continue to have access to information that can help us to track these trends over time. But what we see is that there is a fairly high evidence of substance use in the population in this particular report. And I think these trends, there have been some interesting changes in these trends over time, both because of changes in the demographic use of alcohol, the characteristics of young people who are using substances and alcohol in particular during their teenage years, and also changes in access to or prevalence of things like vaping. Those things have been changing over time, but I think overall the evidence is quite striking that there's still pretty significant usage of these different substances among different populations, particularly looking at adolescents and young adults. And this corresponds with increases in the numbers of overdose deaths over the course of time as well. And so what we see here is this is data from NIDA, from the NIH, and it's showing through 2022 the growth in the number of overdose deaths across the United States. And what we see is that this has been trending over time, increasing as well. We see that all of the different types of outcomes that are included in this figure includes deaths with underlying causes of unintentional drug poisoning, self-harm and suicide drug poisoning, homicidal poisoning, or undetermined intention drug poisoning. So this is a couple of different categories of mortality outcomes that are included in these data. But as you can see, this has been increasing over time. And we see also particularly spikes in the post-2010 period. So now I want to kind of shift the focus. So we've talked a little bit about the scope of mental health and mental illness across the United States, particularly focusing on adults. I want to shift the focus to look at the risks that are posed by extreme weather exposures. So we know that 2024 was the warmest year that's available in the data record, according to NOAA's National Center for Environmental Information. So we see that average temperature has been trending upwards since, for the last couple of decades. And we also know that communities across the United States are experiencing larger numbers of climate disasters that are costing more and more money. So this is showing from 2024 the billion-dollar weather and climate disasters that occurred across the United States, includes things like drought, flooding, severe weather, severe storms and precipitation. Tornadoes, I think there's some limited evidence now that local tornadoes might be caused by local environmental and atmospheric conditions. So they might also be increasing in frequency and severity as a result of local meteorological conditions, as well as, of course, hurricanes, tropical cyclones, and then I'm sure everyone has seen some of the evidence of wildfires and severe wildfire events as well. So I think the reason I wanted to mention this is because even before we factor in some of the different health specific, both acute and long-term health impacts of these different types of climate exposures, we see that communities across the United States are experiencing different types of extreme weather events that might have an impact on health, but that are also having other costs within their communities. And we know from a few years ago from the CDC's third national climate assessment that there are a lot of direct and indirect pathways through which extreme weather associated with climate is impacting people's acute and chronic health endpoints. And so, for today, we're focused in specifically on the mental health impacts of extreme weather. But there are a lot of different pathways through which people might experience adverse mental health outcomes as a result of their environmental risk factors. And so I'm going to try and describe in a little bit more detail some examples specifically pulled from different pieces of literature that look at different pathways through which mental health is being impacted by extreme weather. So, this is a figure that's been pulled from a previous publication, again in 2021, that talks a little bit about some of these different pathways from climate to psychopathology. And it can be through these direct effects, such as extreme heat, exposure to natural disasters. It can also be through changes in the availability of different resources, the changes to traditional lifestyles that have been happening or that people have become acclimated to, and then also structural changes to different landscapes and ecosystems that are occurring as a result of these global changes. And so these are some of the different pathways through which people's mental health may be impacted by their experience of the local climate. And this is pulled from a publication back in 2018 that talks a little bit more specifically about the available evidence on different types of extreme weather events, including extreme heat, hurricanes, floods, droughts, etc. Some of the populations that might be most of concern, and then some of the different types of mental health endpoints that might be associated with these different events. And one of the things that I want to mention is that historically, a lot of the literature on the mental health impacts of extreme weather has really focused on post-event evaluations that leverage available local data resources or have some sort of pre and post implementation of mental health specific surveys. But that provides us with a really good picture into the subclinical and maybe some of the less severe mental health outcomes, and maybe even some of the more severe mental health outcomes that are associated with those extreme weather events. But it has been a little bit limited in terms of that post-disaster, one by one, event by event evaluation. And so I think some of the current changes in the literature and the state of the science has been how can we leverage other types of data resources in order to understand longitudinally what is happening to people as they experience multiple events in their particular location or multiple different types of events that might lead to some of these accumulated stresses that people experience. Again, continuing for pulling from this table, we've talked a little bit about extreme heat, extreme weather. There are other types of climate-related hazards that might also have impacts on people's mental health, including, changes in the spread of vector-borne illnesses, some of those more structural changes that we talked about in terms of changes to the local environment, such as sea level rise, changes in coastal communities, melting permafrost, changes to native ways of life. And then, just the overall awareness of the global changes that are happening can also have its own stressors associated. So this is some data that was pulled from a a integrated pooled analysis across multiple studies and multiple cohorts that were available to look at PTSD after exposure to extreme weather events. Just kind of demonstrating that there is an increase in the odds of PTSD across all of these different specific studies. Um, and this is really interesting because, again, thinking back to what I was mentioning earlier about some of the changes that might be needed in our definition of what constitutes a traumatic event, turns out that repeated exposure to these different types of extreme weather events might actually be one of the newer categories of trauma that we may want to incorporate into our understanding of PTSD and, particularly potential for treatment for PTSD among people who have survived these extreme weather events. Similarly, this study looked at depression after exposure to extreme weather events. The results were slightly closer to the null for this particular study, but we did see some evidence of increases in depression following exposure to extreme weather events, pooling across all of these different studies. And the results for anxiety were more null. So it was hard to determine whether there was evidence of changes in people's anxiety based on this existing data. So I want to focus a little bit on a couple of studies that I've been doing to look at extreme heat and the impacts on mental health in different populations. So I have one previous study that was published in JAMA a couple of years ago that looked at individuals with commercial health insurance across the United States. And we had access to information on the location of residence. So we looked at linking the commercial insurance data with modeled temperature data in order to understand the relationship between summertime ambient temperature and emergency department visits for mental health. So looking at some of those very severe clinical outcomes that are associated with extreme heat. And so we had representation from a broad swath of commercial insurance beneficiaries across the United States. And we found that there was a pretty straightforward association between summertime temperatures, as summertime temperatures are increasing, the rates of emergency department visits for any mental health outcome were increasing as well. But the thing that I thought was really interesting from this particular study is that we didn't only see these increases in the rates of emergency department visits for mental health conditions when we looked in aggregate at all types of mental health endpoints. We really parsed out to look at specific disorders, and we found that there was an increase in the rates of emergency department visits across a host of different mental health endpoints that are not super closely related to each other as a result of people's exposure to extreme heat. So a variety of things, including substance use disorders, anxiety, schizophrenia, self-harm, a lot of these different health endpoints, the rates of emergency department visits were increasing as temperatures were increasing. We also found that this wasn't limited to the most extreme periods of heat. Even if we look at, a larger set of the warmest days every summer compared to the coolest days every summer. So we can consider the 95th percentile of temperature as maybe the 5 or 6 hottest days each summer. We could consider the 80th percentile as maybe the 15 or 20 hottest days each summer. And we still see, so there's a pretty clear dose response. So a lot of those 80th percentile of the local warm season temperature days, those are going to become some of the days that we expect to see a lot more frequently given the shift in the temperature distribution. So we might expect that, correspondingly, we'll see an increase in the need for emergency care for mental health causes on a larger set of days every summer. And, it might seem like it's relatively mild. We see a 7% increase, a 5% increase in the rates of emergency department visits. But then we consider that this is over 3.5 million ED visits were used for this particular study, and then we start to consider the greater and greater number of days that we might anticipate experiencing in this temperature range, and then these effects start to compound in terms of the absolute expectation for the need for emergency department care during these summertime periods. But this previous work was missing some of these less severe presentations of adverse mental health that might be associated with heat. We're also focused on individuals who have access to commercial health insurance. And we didn't consider other types of disasters or meteorological characteristics in this particular study. So what are some of the potential pathways that might explain the results that we saw? Um, the thing that I think was really interesting in this initial study is that we were looking across all of these different types of health endpoints. And we know that extreme heat is an exogenous stressor that might be exacerbating people's existing mental health conditions. We also think of potential for sleep disruption during periods of high ambient temperature, which might lead to adverse mental health outcomes. Or we've seen an increase in the number of studies that have indicated that people who are exposed to extreme heat might experience increased agitation or irritation as a result. And so I think this is a really interesting line of inquiry that several folks have been looking into, increases in aggression associated with extreme heat periods. Um, and we also think that poor mental health is associated with potentially displacement in the wake of different types of disasters. So, with respect to extreme heat, it might be more difficult to see this as a mechanism, although we do know that particularly people who have housing insecurity or instability or people who are unhoused might be displaced in their urban environments as a result of heat exposure. Um, and then finally, I'm going to talk a little bit more later about changes in conflict as resources become scarce as a result of these different types of environmental stressors. And then there is some evidence of this new phenomenon, which we call solastalgia or climate anxiety, which is the increase in hopelessness, maladaptive anxiety, and stress that people experience as a result of their anticipation of future changes as well. Um, So the next stage of my own research has been to look at assessing mental health in vulnerable groups in Boston. I have a collaboration with the Boston Emergency Services team, which is an emergency services intervention that was implemented in 2005 in the greater Boston area to provide access to psychiatric emergency department care for people who are publicly insured or people who don't have health insurance. This data set includes approximately 18,000 clients who are served by BEST on an annual basis. And what we've been doing is looking at, do we see similar increases in the rates of emergency department visits associated with summertime temperatures among these uninsured or publicly insured individuals in Boston? And this work is being led by a doctoral student in my research group. And what we see is that the rates of emergency department visits are actually much higher for these vulnerable populations who are on public insurance in the greater Boston area. So this is showing the year-round actually association between temperature and psychiatric emergency department visits in Boston. And we can see that in the warmest periods in the summer, there can be, up to a 25% increase in the rates of emergency department visits compared to the coolest days of the year. When we look at subgroup analyses, we don't see a lot of evidence of heterogeneity, except when we look at housing status. So counterintuitively, we see that unhoused populations have a relatively flat risk curve as temperatures change. And by comparison, folks who have stable housing in our data have an increase in the rates of emergency department visits during the summertime period compared with the coolest period of the year. And so we think that underlying these results are the fact that people who are unhoused experience so many different intersectional vulnerabilities that they remain vulnerable across the entire temperature distribution. And by comparison, Boston is a city that is well prepared for cold. And so we know that temperatures inside of homes in the greater Boston area can be a couple of degrees warmer than the outside environment during those warmest summertime periods because, housing may or may not have air conditioning, it's well insulated. So extreme heat might be getting trapped in those homes, which may start to explain some of the changes in the distribution of risk that we see at the higher end of the temperature distribution here. So some of the key takeaways from this work in the Boston Emergency Services data, we see increased rates of emergency department visits for mental health in the best population, and we're continuing to investigate some of these different vulnerable subgroups. So I'm going to shift now to a separate example from the literature looking at increased exposure to natural disasters that are associated with climate. And this is from a series of different studies that have looked at different types of extreme weather events. So this is prevalence of PTSD after exposure to floods. Um, and what we're seeing here is that overall, we do see an increase in the prevalence of PTSD across multiple different studies that have looked at different cohorts in different locations around the world. And this meta-analysis kind of demonstrates that there are potential for increases in the risks of PTSD due to people's flooding exposure. This is a relatively recent study from 2022 that's looking at the association between adverse experiences during Hurricane Maria and mental and emotional distress among adults in Puerto Rico. And what this study found is leveraging some survey data. They were looking at experiences of different types of depressive symptoms, PTSD, and generalized anxiety disorder. And what they found is that the total hurricane experience across all of these different metrics was associated with higher odds of these different types of mental health outcomes. And additionally, the continued loss of services that people experienced in the wake of the hurricane was also associated with increased odds of different types of depressive symptoms and anxiety symptoms as well. This is another study showing the impact of disaster on mental health among women. This is a case study focusing on the 2022 flash flooding episode in Bangladesh. And they found that flood-related injury or illness, loss of a family member in the flood, family violence, and also property damage were all positively associated with increases in different types of depressive symptoms and anxiety symptoms as well. These authors recommend the widespread adoption of a protocol called psychological first aid, which is intended to be analogous to the first aid that disaster victims receive for physical trauma. It includes things like contact and engagement, availability of comfort and stabilization, provision of information and assistance. And I think this is something that we could consider building on. This idea of psychological first aid could be widely adopted, not just post-flood event, but post other types of climate-related extreme weather events. Um, so it's not only through these direct mechanisms that we've been talking about extreme heat exposure, extreme weather exposure. There are a whole host of other mechanisms that might potentially link extreme weather and mental health outcomes. So I want to talk a little bit about ecosystem degradation and food insecurity as well. So we know that extreme weather events have an impact on our ability to get access to good, nutritious food. So two of the different risk factors that I want to mention is they are heat waves and drought. So this figure is from the Lancet Countdown from the 2023 report and talks about change in the share of population that reports moderate or severe food insecurity as the number of days of extreme heat or drought are changing during the growing season of 4 of the major crops globally. And this is showing the changes in the 2014 to 2021 period compared with the previous couple of decades, just kind of illustrating that food insecurity is on the rise during these more recent years. And this kind of shows that food insecurity is associated across the globe with mental health indices in different regions. And so we know that as people start to experience more food insecurity, it will have impacts on mental health based on the available evidence. And we also have some meta-analyses across multiple studies that have looked at association of food insecurity and risk of depression, showing that there is an increase in risk of depression as people start to experience food insecurity across multiple different studies. And we also see similarly increases in the risk of stress or stress-related symptoms. And so, these are some of the different outcomes that are associated with food insecurity. And one of the other pathways that I mentioned is ecosystem degradation and migration. And I want to tie conflict in, although the association between conflict specifically and some of these different extreme weather events hasn't been very well underpinned in the literature. But I think it's important to mention because it seems like a very natural pathway. There's some sort of resource scarcity, either food insecurity, water insecurity, one of these other mechanisms that we've mentioned. And then potentially that leads in and of itself to conflict, which can have implications for migration, can also have implication for mental health directly as well. So I wanted to mention it as being a potentially important component of this pathway. So this is from a study that was published in 2019, and it's just showing different areas in the world that have had conflicts across different periods. So you'll see the earliest conflicts are shown in the very light yellow circles, and then more recent conflicts between 2010 to 2015 are shown in the dark red circles. And it's also overlaid on top of soil dryness. So this is indication of drought conditions. And what we can see is that the places that have very, very severe drought conditions have a tendency to have larger conflicts. So this is a correlation, not necessarily implying causation, of course. But what we can see here is that areas that have uh, wetter conditions, so less frequency of drought, seem to tend to have less of these indicators of conflict, which is an interesting correlation. And what we see is this is from another study looking at exposure to conflict and violence and mental illness. And what we see is that the prevalence of the overall prevalence of mental illness is relatively quite high during conflict and also tends to continue to be elevated post-conflict as well. Some of the other populations that we've looked at include migrant populations, military populations, civilian populations, and we see that there is some evidence that each of these populations experiences some spikes in mental illness as a result of exposure to conflict and violence. And so one of the things that I wanted to pull together for this particular session is to look at comparisons between some of these different indicators. So this is a figure that shows the number of IDPs, so internally displaced persons, shown in the size of the circles, and then the share of the population that's facing food insecurity. So what we can see here is that in places that are more food insecure, we have larger numbers of internally displaced persons due to a combination of conflict, violence, and also disasters. And this is data as of the end of 2022, so I think we have a little bit more updated data. As of the end of 2023, the Internal Displacement Monitoring Center estimates that a little over 75 million persons were internally displaced as of the end of 2023. And what we see here is that of that 76 million, 68 million, or a little over 68 million, were displaced as a result of internal conflict and violence occurring in different countries around the world. This represents an increase in the share of people who are being internally displaced by conflict and violence compared with the previous year, 2022. And we can kind of extrapolate from this a little bit and look at the number of people who are being displaced by disasters. So we see that according to the data in 2023, a little under 8 million people were internally displaced as a result of disasters. However, I don't think this is capturing the complete picture. So this is representing a decrease in the number of people who are internally displaced by disasters globally. However, if we consider the fact that there might be this pathway from disaster to resource scarcity or food scarcity or other types of scarcity to conflict. And then the conflict itself might be the predictor of displacement, but it's maybe not considering these upstream drivers of the conflict. We might be underrepresenting the proportion of the population who is being displaced as a result of these different types of environmental risk factors. Um, and then one of the other things that I wanted to pull in, this is some evidence that shows the prevalence of mental illness among refugees and asylum seekers. This is from a study that was looking, again, across multiple different studies that have been done in different populations around the world. And this is from 2020. And what it's showing is that there is a relatively high, particularly for PTSD outcomes, there's a relatively high prevalence of PTSD and depression among refugees, among asylum seekers. And this is not limited to people who are displaced because of climate-related events, but we can certainly consider that these different types of symptoms might be occurring in these populations at a greater rate partially because of the experience in their locality, and then partially because of the act of being displaced itself. And then here we have a study that looked at mental health of migrants who were exposed to armed conflict before they moved. And what we can see is that although it doesn't appear to be statistically significant, we do see some increases in the prevalence of PTSD among migrants who are moving as a result of the armed conflict that they've experienced. Similarly, we see some changes in different studies in the diagnosis of depression among migrants, although this one, when pooled, is also doesn't appear to be statistically significant. And then when we look at anxiety, once again, we see in several studies, we see some evidence of increases in the diagnoses of anxiety among these different migrant populations. So I want to talk a little bit about who it is who bears the burden of these different mental uh, uh, issues, mental health issues, and mental illnesses as a result of the different types of exposures that they're experiencing. So this is a report from the Kaiser Family Foundation that was from 2023 that looks at the share of adults who are reporting symptoms of anxiety or depressive disorder. And the reason why I wanted to share this data is because we see that the shares of adults in the United States who are reporting anxiety symptoms, depression symptoms, it's really high among young adults. So these issues are really hitting young people and young adults differently than they hit older adults across the US. And so this is something where I think it's important to keep in mind that unlike several of the other physical health endpoints where you kind of expect to see increases in the prevalence or in the rates of physical health issues as populations age, mental health symptoms might actually be concentrating in younger adult populations, which I think is really important to mention. This is another study looking at Gallup polling data, showing, again, similarly that lifetime depression diagnoses and current treatment for depression appears to be concentrated among younger adults as well. Of course, there are some other sociodemographic characteristics that appear to be predictors of diagnoses, including race, ethnicity as well. And then, we can look at other types of outcomes. So this is age-adjusted drug overdose deaths per 100,000 across the US, by race, ethnicity. And what we see is that these age-adjusted overdose deaths have been increasing across time. So the dark blue bar represents 2018, the orange bar represents 2020. I think we've ended some of the figures in 2020 because, of course, at the start of the pandemic, some of these mental health outcomes were changing by numbers. So it's a little bit difficult to disentangle things that are happening post the start of the pandemic with pre the start of the pandemic. But we see that generally the trends are on the rise across all of the different racial and ethnic categories that we included in the data. And this is a story that's true not just in the United States. It's a story that I think is replicating across the world. So we see changes in the share of people with anxiety disorders over time. This is from the Institute for Health Metrics and Evaluation, their Global Burden of Disease study. We see that anxiety disorder prevalence is on the rise. We also see that depressive disorder prevalence is on the rise as well. And then we see that bipolar disorder, other types of mental illness also on the rise over time. And there's evidence of disparities in weather-related outcomes by state across the US as well. So there's evidence that the extreme weather events that we experience. So there's a wide array of extreme weather events that are being experienced in different parts of the United States. And we do see evidence that there's differences in the number of studies that are happening in different communities across the US. And we also see that there are disparities in the different outcomes that are associated with these different events if you look at different communities across the US. And we also see that there are a lot of different ways that we could parse out who might be the most vulnerable to the different adverse health impacts or mental health impacts that are associated with extreme weather. But people also have differential access to care across the United States. And this is something that I think this particular study is a few years old at this point. So I think that if we looked at more updated information about access to mental health professionals, particularly looking post-pandemic, we would see that some of these different disparities in the access to mental health services have probably been exacerbated over time. So how do we start to address some of these issues? In the city of Boston, there's a relatively good climate adaptation plan that includes a lot of development initiatives, education initiatives, zoning initiatives, a host of different tools to try and combat some of the different environmental risks that might present as a result of extreme weather. And a few years ago, a doctoral student in our program at Boston University started looking at cooling centers as one example of an adaptation strategy. Cooling centers have been broadly implemented in cities across the United States to try and mitigate some of the health impacts of extreme heat exposures. But as you can see, there's pretty wide differences in the percentage of the population that has access to these cooling centers. And here we were considering access as being within walking distance to the nearest cooling center. So this might be an indicator of different adaptation capacity in different communities. For example, maybe Houston, Texas doesn't really need cooling centers because everybody has air conditioning in their homes, whereas in Chicago, the homes aren't built with air conditioning available, and so it might be more important to provide access to those cooling centers. But I think one of the questions that this metric of access isn't really answering is how many people are actually using those cooling centers. So we have some preliminary evidence in Boston that people may not be actually using the cooling centers that are available. And one of the reasons for this we hypothesized is because initially it could be very difficult to get access to this information on where the cooling centers are located. So this is the list of cooling centers from 2024. Initially, this list was published online and it was just providing the Boston Centers for Youth and Families were the cooling centers that were open in our city. And it just provides you with the address and the hours that the cooling center is available. So last summer, there was an effort to try and create this in a more visual representation of where the locations were for the cooling centers. And hopefully this type of adaptation strategy continues to be more well implemented so that local communities can have access to the information that they need that might be helpful when they're preparing for these types of extreme weather events. But, we anticipate that there will continue to be increases in the displacement, in the different types of extreme weather events that people are experiencing, and in the ways in which mental health is associated with these different types of extreme weather events. So I think that it's important to keep in mind that each of these different types of adaptation strategies should be well developed in order to facilitate preparedness and response within each of the different communities. We've kind of talked through a whole host of different types of populations that might be vulnerable to the adverse impacts of extreme weather. And so this is some information from the World Health Organization from their Global Health Data Observatory from 2022. And it's talking about whether or not different communities and different countries have standalone policies or plans for mental health. And it seems like there are some places in the world that do have these policies, and then there are some places in the world that have not yet developed preventative policies to try and facilitate continued intervention for mental health. So I think this is a really interesting set of information on what are the different types of budgets that might be needed, targets that will be met, et cetera. So it's really important to keep all of these different considerations in mind for the development of different preventative efforts. And one of the things that we can talk about also is the coverage of mental health included in, talking about extreme weather events in different academic journals, in the media. It's on the rise, and hopefully that trend will continue. We'll continue to make these linkages between extreme weather, mental health, and the combined effects of different types of stressors on people's mental health and well-being. So once again, wanted to mention the disclaimer, and I'm very grateful to all of the different teams that have participated in these different research projects that I've shared about today. I'm very grateful to all of the folks who are working in this area of extreme weather and mental health. And with that, I will just pause and happy to answer any questions. If anyone would like to ask a question, please feel free to raise your hand. I see a couple of questions have come in the chat, so I'll go back to some of the initial questions. So Tom Phillips asks, emergency response and other endpoints, or ER and other endpoints, how well have the impacts of homelessness and housing type been examined? That's a really good question. I think examining the status of people experiencing homelessness is very challenging in this context. Of course, access to data and information is relatively scarce. I did share the one example of the Boston data. I think there have been a couple of other examples, especially across the United States, trying to characterize the experience of people who are unhoused. And that's an ongoing area of research. There's another question here from Ghazale. Impressive results. Did you use claims data from commercial insured individuals? If yes, how did you link mental health to heat and temperature? I mean, some of the mental health emergency visits may not be related to heat. That's a good question. So what we did for the commercial insurance data, which is the study that I shared from JAMA from 2022, we did look at claims data for commercially insured individuals. For each of the claims, we looked at the diagnosis codes to look for mental health related emergency department visits. And then we looked at, we applied a case crossover study design. So we looked at acute exposure to heat on the day at the location of the ED visit. And so we were looking at whether there were short-term fluctuations in the rates of emergency department visits, and then did comparisons within the same individual across time to see if the emergency department visit on a particular case day was associated with temperature. So that's kind of how we looked at this question. So there's a question here from Yoko Nomura. What does conflict mean? I think that the different programs that I've gone through in the presentation have different definitions of conflict. So I might suggest going back and visiting some of those data sources. I think conflict gets recorded specifically as armed conflict, and there's some threshold of the number of people who are participating in an armed conflict in a particular area or particular region over a short period of time gets categorized as a conflict. So it's a pretty broad definition of conflict from the original data source. Tom Phillips asks, how effective have mental health interventions been for climate impacted areas? For example, US Midwestern farmer suicides and mental health, et cetera. I think this is a really good question. I think that there are different types of mental health interventions that have been implemented in different communities across the US. The example that I provided, the Boston Emergency Services data, is particularly built for an urban environment. This is a part of a state mandated requirement. So the state of Massachusetts has different emergency psychiatric provision across the state of Massachusetts. I think it's a fairly state-specific program, and I think there are different states across the US that have implemented different types of interventions. Emergency department interventions are still relatively quite expensive from the perspective of the burden on the healthcare system, the burden on the individual visiting an emergency department is obviously relatively quite intense. I think there have been other types of mental health interventions, preclinical programs, talk therapy, telehealth. I think there have been a lot of different advances over the course of the last decade, in terms of their ability to try and reduce the impact of different environmental exposures on different mental health endpoints in communities. Um, I don't know that we have solid evidence. My intuition is that the trend in mental illness has been increasing, and I don't know that the interventions have kept pace or that clinical work has kept pace with the increasing trend in the prevalence of these different mental illnesses. So I think this is an important area for future work. Um, we have a question from Kai Crockett. This can be answered at the end. I was curious, since these wider level federal tools are not being used, is there any sense of the metrics local and state health departments are using to assess these mental health impacts? I think, again, there's wide variation by state. I think some states are doing a fairly good job of documenting information. A lot of states have different types of health analytic information that they collect. In the state of Massachusetts, this is centralized for emergency department visits and hospitalizations, but I think different programs exist in different communities across the US. Can we link, this is another question, Joy Nakazibwe, I'm sorry, I apologize for the name. Can we link chronic mental health issues to climate change? I think we can only link the acute ones, not sure though. I think there have been some studies that have looked at linking chronic mental health conditions to particular events. Post-Hurricane Katrina is another example of where the literature has been relatively quite rich. So I think, you know, there have been some studies that have linked specific events to both acute and chronic mental health conditions. But I think there are methodological challenges for looking at repeated exposures or chronic exposures to extreme weather and then mental health endpoints. Let's see. Anna Reed asks, can you speak to how the normalization of talking about mental health issues and seeking help among younger adults may be impacting the higher prevalence of mental issues among that age group? That's a good point. I do think that there might be higher rates of diagnoses among obviously folks who are seeking mental health care. And so potentially there might be some component of this that is because younger folks are more comfortable seeking mental health care might explain some of the higher prevalence. I'm not sure that I would necessarily anticipate this big of a gap, though. I think at least some portion of that is because the onset of mental illness tends to happen in earlier age groups. So young adulthood or adolescence tends to be when some of these more severe symptoms start presenting, such as schizophrenia. So I do think that it's probably a combination of the onset and progression of mental illness, and then also some normalization around being able to talk about mental health conditions. Let's see. In the interest of time, I think I might wrap up there. Please feel free to reach out to me via email if you have a question that I wasn't able to answer. I apologize. I see a lot of different questions that I wasn't able to get to, but please feel free to send an email. And thank you so much for joining today.